Multi-wave oscillator used in a New York hospital. Georges Lakhovsky crossed the Atlantic to New York City in 1941, there to observe the effects of his MWO under controlled, technical conditions in a New York hospital. A brief report of the positive and beneficial results of MWO treatments is appended to the English translation of his book, The Secret of Life, by Mark Clement, on page 201. These treatments were given from July 1 to August 21. The name of the hospital and of each patient are withheld for ethical reasons. Patient illness treatments results. Arthritis, both knees 14 patients, good improvement. Endocervicitis. Abdominal pain, 6 patients, condition good. Periarthritis of shoulder, 12 patients, marked improvement after first treatment, condition good. Osteoarthritis, 7 patients, marked improvement after 2 treatments, stiffness diminished. General chronic arthritis 11 patients, improvement. Arthritis of ankle 3 patients, results good. Postoperative fracture 6 patients, results good. Arthritis, both knees 14 patients, marked improvement. General arthritis 8 patients, marked improvement. Epicondylitis of elbow 7 patients, results good. Chronic arthritis 10 patients, no cough, no soreness, marked improvement. General arthritis 10 patients, marked improvement. Arthritis and circulatory disturbances 6 patients, improving. Arthritis of ankle and knee 7 patients, improvement, no recurrence. Arthritis of shoulder 7 patients, marked improvement. Tenosynovitis, hands 6 patients, improvement. Arthritis, both knees 7 patients, improvement. Congenital hip dislocation 3 patients, marked improvement. Fracture, both all knee. Synovitis, both knees 5 patients, no pain. Additional cases. Case 1. G.D., female, age 25, patient complained of pain in the chest and muscles of the right arm and back, and constant couch. She did not respond to medical treatment and massage. Treatment with Lakhovsky multiple wave oscillator was instituted. After the 4th treatment, coughing stopped, pain in the chest became infrequent, and the tired feeling in the back disappeared. At the end of 12 treatments, the patient no longer complained of the previous symptoms. Case 2. M. Female, aged 51, patient complained of pain and stiffness in the right hip. X-ray examination disclosed a marked narrowing of this articulation associated with large spurs at the margin of the acetabulum, which appeared to ankylose of the joint. There were proliferative changes to the upper margin of the femoral head. Diathermy and massage failed to relieve the pain and stiffness. After 10 treatment with Lakhovsky's multiwave oscillator, the stiffness markedly reduced. Case 3. F.T. Female aged 38. For 2 months the patient complained of pain in both shoulders. Abduction of the right humerus was limited to 45 degrees. A diagnosis of periarthritis was made and treatment with Lakhovsky's multiwave oscillator was started. After 3 treatments the patient said she felt much better. The improvement continued. After a series of 11 treatment the patient did not return. Apparently permanent relief had been obtained. Case 4. A.B. Male, aged 60, patient gave history of pain in both knees beginning in 1940. Diathermy and massage for 1 year gave only slight relief. Treatment with Lakhovsky's multiwave oscillator was instituted. After 1 treatment patient stated that he felt better. After 4 treatments patient felt so much better that he took only 1 treatment in 2 weeks. Case 5. M. Female aged 42, patient complained of pain in lower left back and hip. X-ray examination of lumbar spine and pelvis showed calcification at the anterior margins of the intervertebral discs between the 9th and 10th and the 10th and 11th vertebrae. There was also a slight scoliosis of the lumbar spine. With Lakhovsky's M.W.O. was instituted. After the first treatment, patient felt better. After the fifth treatment, improvement was very marked. Patient did not return after 9 treatments. Case 6. S. N. Female, aged 59, patient complained of pain in the right shoulder and inability to extend the arm more than 5 to 10 degrees, accompanied by severe pain. X-ray examination disclosed irregular calcification in the region of the greater tuberosity of the right humerus. Treatment with Lakhovsky's multi-wave oscillator was instituted. After 1 treatment, patient said she felt much better. The improvement continued steadily until the 10th treatment we completed. Case 7. C. P. Female, aged 38, gynecological examination showed uterus slightly enlarged and hard. Right parametrium tender. Diagnosis: parametritis. Treatment with Lakhovsky's multi-wave oscillator was instituted on July 17, 1941. After 4 treatments, patient felt better, and after 12 treatments, patient was found to be much improved. Examination on October 7 showed the adnexa and parametrium to be painless. Patient was considered cured. Report of cases treated with Lakhovsky's multiple wave oscillator by a prominent Brooklyn urologist. The following results were obtained by a prominent Brooklyn urologist whose name must be omitted for ethical reasons. He is a fellow of the American College of Surgeons and enjoys a great reputation as a skilled specialist. He treated hundreds of patients with Lakhovsky's MWO, but only a few typical cases can be given here. Patient illness treatments results. Hg acute urinary retention to do enlarged prostate retention ceased. Rb bleeding from uterine fibroids of 2 years standing, bleeding ceased. SM mild multiple sclerosis with halting gait marked improvement, was able to run on several occasions. RR cellulitis of nose with pain cleared completely after 2 treatments of 10 minutes each in 1 day. BT acute urinary retention due to enlarged prostate, retention ceased. SB bleeding from cancer of the bladder, bleeding checked. The tumor cleared up nicely and was reduced in size when seen again on cystoscopy 3 weeks later. JG chronic eczema of axilla, cleared entirely. LG severe pains from duodenal ulcer, greatly improved. Georges Lakhovsky. In addition to the above cases, this Brooklyn specialist treated 6 cases of enlarged prostate with nocturnal frequency, 3 to 5 times per night. After 2 treatments with Lakhovsky's multi-wave oscillator, frequency was reduced to only once a night or did not occur at all. The above American reports were not included in the first edition of George Lakhovsky's The Secret of Life, published in 1935, but were added by the English translator, Mark Clement, to later editions. We are quoting from the 1963 edition published by Health Science Press, Sussex, England. Health Research, P. O. Box 70, McCullamy Hill, California 95245, offers this same book. This early, 1941, Research with the Lakhovsky equipment seems to have been ignored by the American medical authorities, who are still concentrating on cure by surgery or medicine. If you want to discover the effects of weak radio waves on living organisms, you'll have to dig for yourself. Public recognition of radio wave treatment. This sensational advance in the treatment of human ailments should have been welcomed from coast to coast in every newspaper. Dr. Blackberg and his distinguished fellow scientists from Baylor, Arkansas and Harlem should have received public acclaim from President Kennedy's Department of Health and Welfare and from the American Medical Association. But only a thunderous silence followed that early 1962 news item on the private meeting in Washington, until the August 24, 1963 edition of the Saturday Evening Post. In this national magazine, radio wave treatment of arthritis was branded medical quackery and the article Hucksters of Pain. Their Drs. Smith, Street, Cameron, LaBelle and Blackberg had their answer to government support for expanded research. Fortunately, not every American is going to take this kind of libel without striking back at the mouthpieces of the vested interests who lend themselves so readily to control of the mass mind. Read this news clip from the Los Angeles Times for November 1, 1963. Saturday Evening Post sued for $7.5 million. New York, the Saturday Evening Post, still smarting from one of the largest libel awards in history, was hit Thursday with another libel suit demanding $7.5 million. The suit was filed in federal district court here by the Diapulse Corporation of America, manufacturer of a machine that employs high-frequency waves in the treatment of infections and inflammations, including arthritis. The company said it was defamed in an article, The Hucksters of Pain, which appeared in the August 24 edition of the magazine. The article dealt with quack remedies for arthritis. The suit seeks $2.5 million in compensatory damages and $5 million in exemplary damages. Then follow several pages of photos of before and after cancer cures and medical reports from doctors. This one is typical, from Dr. Nicholas Gentile, chief radiologist of the Clinic for Incurables of the Apostolic Ladies of the Sacred Heart of Jesus, Rome, published in the Medical Review Medicina Nuova 26, N.5, 1935, Rome. Effects on the nervous system. Generally speaking, I have observed a marked analgesic action following the application of the multiple wave oscillator in all affections associated with pain, particularly in the classical cases typical of such affections. For example, a patient suffering from cephalalgia, resulting from violent cranial trauma, for a duration of 10 years, was subjected to a great variety of treatments, but all in vain. This patient was definitely cured after 2 months' treatment with the MWO. Improvement was manifest after only 3 applications. My mother, age 72, who has suffered from hypertension and glaucoma for many years, measured absolutely normal blood pressure the morning after her first treatment. And the eye tension, tested by her MD the week following, had dropped to a lower point than in the previous 2 years. Another woman with a long-standing back condition says she was permanently relieved in one 15-minute exposure. An asthmatic with chronic bronchial complications claims he is now symptom-free after 2 exposures, and her husband with a bad dermatological condition of 7 years history appears to be very definitely improved. Perhaps the most dramatic is Mr. NVC, who had broken his leg skiing last December. Because of an old polio complication, the broken leg had never healed and flesh surrounding the fracture was in a very poor, waxy condition. After one exposure, he phoned to say he had regained feeling in the area. The next day we made an after photo slide of nearly normal tissue. A friend suffering allergies of long standing says she can now eat anything, and her MD admits he is startled by her youthful appearance and new vitality. The Lakhovsky literature illustrated many such rejuvenations as an unexpected side effect of cancer cases. Subjects' wrinkles disappeared along with the tumors. Lakhovsky multi-wave oscillator. By Bob Beck. Treatment with the multiple wave oscillator mobilizes the body's own self-healing reserves. Thus the range of diseases that can be treated is infinite. Degenerative conditions develop when the body's self-healing reserves lose their power. Infections, cancers, inflammations, skeletal degeneration and organ dysfunctions then develop, but often such conditions can be reversed if these reserves are revived. Even fractures and cuts can be healed in a fraction of the normal time. Neural dysfunctions, from headaches to deafness to paralysis, can be normalized. The multi-wave oscillator has been used successfully to treat arthritis. Can any such a cure-all really exist? If there is a generalized life force enhancer, then the answer is yes, and this may be it.